Hello, my name is Doug Lister. I'm going to be doing a brief demonstration of Adaptomed's EHR Your Way. At the end of this demo, if you'd like some additional information or would like to see another demo, you can contact Jay Lasney, and Jay's number is right here at 877-478-7773. Okay, so I'm going to come over to my EMR, and checked in and waiting for me is Angie Smith. She's here for follow-up diabetes. I'm going to open her chart, and I see she's got diabetes type 2 without complications. These are the two medications that she's on, a family, social history, and allergies. So now I'm going to just jump over to my progress note. I'll open up my vital signs that were obtained by the medical assistant. I'll populate those in the EMR and review them. I'm going to see her for this problem. So this populates my diagnosis. And now I just dictate my note. Miss Smith is a 56-year-old female who comes in for follow-up of her diabetes. She has been checking her blood sugar regularly, and her fasting blood sugars are between 90 and 135. She does not have polyuria, polydipsia, or polyphagia. She has had no episodes or symptoms of hypoglycemia. New paragraph. She has a past history of diabetes type 2 for 5 years. Medications include metformin 500 milligrams BID and Lipitor 10 milligrams daily. I'll give you a second to review that. And next I'll navigate to my examination, but before I do, I just want to review and see if I have any labs on her. So I'll open this up, and I do have a lab from today. And that was her hemoglobin A1C at 6.2. So now I'll just navigate to my exam, go to exam, open exam. So this is a template of a normal exam, and we would simply place your normal exam here. And I'll just show you an example. If one of your findings is abnormal, you would place your cursor where that abnormal finding was and dictate. Auscultation of breath sounds reveals inspiratory, expiratory wheezes, rales and bronchi noted throughout. Symmetrical chest wall expansion, trachea to midline. And then you would simply say, okay, and here's your exam. If I want to do a review of systems, go to ROS, open ROS, select denied all, and maybe she complains of shortness of breath or orthopnea. If so, you would check those or uncheck those and put them here, complains of, and say okay. And now you have a full review of systems here. So this could also be completed by your medical assistant. And now I'm ready to go to my assessment. Go to assessment. A 56-year-old female here for diabetic follow-up. It is well controlled with diet and weight loss. There are no symptoms of hyperglycemia or hypoglycemia. And blood work confirms good glucose control. Paragraph, plan, next line. Number 1, continue to follow diabetic diet. Next line, number 2, return to clinic in 3 months for follow-up. Next line, number 3, check hemoglobin A1C and fasting lipids 1 week prior to next visit. Okay, so now that my plan is done, I just need to order those 2 lab studies. Open order sets. And to the left is all of the order sets that are available to me. I'm going to select number 4, which is my diabetic order set. 4. And with my voice or with my cursor, I can move these orders that are in the center box to the right. Go to box 2, 2, 3, those 2 orders now have populated over here. I just save my orders and I sign off. And this is what your note looks like. The orders that I sent to the lab are going to be completed by my medical assistant. and they're waiting for her to do. I'll show you in just a second. So here's the note. And these are the orders they're waiting for my assistance to. There's several orders in here, but here's the 2 orders that I just ordered here. And then back to the progress note. So I'm creating a new note on her, but if I want to see the last note, I can push this over. And now I can see all of her old notes. So if I'm starting a new progress note from this list, I can see what I did the last time I had her. So again, if you would like to have more of a thorough presentation, contact Jay Lasney. Here's the number again, 877-478-7773, and he'd be happy to set up a time for a demonstration. Thank you for your time.